we meet people where they're at with their drug use, we can support them today and build rapport, build trust, and that helps get people connected when they're ready, if and when they're ready, to treatment. My name is Tessa Rife Pennington. I'm a pharmacist by training and a clinical pharmacist practitioner. I have worked with the Veterans Health Administration since 2010. I currently work at the San Francisco Veterans Affairs healthcare system. I'm a harm reduction coordinator. Harm reduction has been around for a long time, and is kind of rooted in the idea of just keeping people safe and alive. There's harm reduction strategies we use in our everyday lives. We often don't think about, they're just kind of normal, like wearing seat belts, wearing helmets, street lights, stop signs. All of those are evidence-based strategies that keep us safe and alive. They prevent accidents, injuries, even things like sunscreen to prevent sunburns, to prevent skin cancer. In harm reduction, that term we typically kind of associate with strategies to keep people safe who use drugs. It's a philosophy that has been around for over 30 years, and is really rooted in the idea that we want to keep people who use drugs safe and alive and well, and prevent infections, prevent overdoses. The idea was developed by people who use drugs to really empower each other to stay safe. And it helps support people of marginalized communities who are often left out of traditional healthcare, left out of traditional access to resources, to really empower them to keep themselves safe and alive. There are many examples of harm reduction. One is a syringe services program, which we have so much evidence for these programs, really starting from the ground up, distributing sterile syringes to prevent drug-related infections like hepatitis C, HIV, and skin abscesses and wounds. This is really vital because we know that when people don't have access to resources like clean syringes, they may share syringes with others, they may reuse syringes, and that really increases people's risk for preventable infections. We know that people who use drugs are often unaware that they have HIV or hepatitis C for some time. And so during that time, if they share syringes with others, there's a risk for transmitting those infections to other people. We know that providing sterile syringes does not lead to increased drug use, which is one of the most common concerns that I hear. Fear that syringes is enabling, it is kind of counterintuitive. But really what we know is that when we meet people where they're at with their drug use, we can support them today and build rapport, build trust, and that helps get people connected when they're ready, if and when they're ready, to treatment. And we know that people who engage with syringe services programs are 5 times more likely to start treatment, and 3 times more likely to stop using drugs in the long term. So these programs really work. And these programs are not just about syringes. They provide a wider range of wraparound care, services like medication for opioid use disorder, wound care services, infection testing for sexually transmitted infections, offering medication like HIV PrEP to prevent HIV, and other things like housing, clothing, food, sleeping bags, tents, things that people need to just be safe and alive in their daily lives.